Welcome to This Week Health Conference. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels and events dedicated to leveraging the power of community to propel healthcare forward. Today, we have an interview in action from the fall conferences on the West Coast. Here we go.
Hi, here we are again at the CHIME Fall Forum for another interview in action. My name is Sue Schade. I'm a principal at StarBridge Advisors, and I am joined today by two wonderful colleagues. Nassar Nizami, who is the new CIO at Exact Sciences, and Cherodeep Goswami, who is the Chief Digital Officer at University of Wisconsin, UW Health. So welcome, guys, and don't make me laugh too much here, but we've been laughing as we got ready for this. Let's start with you, Nassar, and you're in a new position, Exact Sciences. I'm gonna guess that our listeners don't know what Exact Sciences is, and I know that you are going to easily tell us.
Absolutely. First of all, thank you for having me. So Exact Sciences is a clinical research company. We develop products to eradicate cancers. Most of your listeners are going to know us by our flagship product called ColoGuard. So Exact Sciences is a maker of ColoGuard, but we have a number of other products in precision oncology, essentially cancer detection, screening, and so forth. So that's, we are based out of Madison, Wisconsin.
Okay, so my two Madison colleagues. And did you know ColoGuard?
Yes, we do. And again, thank you for having us on the
Okay.
show. And as I'm thinking through, this is what healthcare needs, where an academic provider meets a life sciences creator out here. This is the new form of interoperability that we should be all working towards. So.
Absolutely, absolutely. Okay, you want to comment at all on UW Health? What's
So
going on
UW
there?
Health is, again, as much as we are University of Wisconsin Health, we actually operate in Wisconsin and Illinois.
Right.
And so part of our opportunities going into 2024 is actually a tighter integrated system across our facilities in those two states. But truly, right now, our biggest areas of focus are workforce, and workforce. And so everything that we can do to manage our hiring workforce to meet the needs of our patients and technology can help. That's where I am interested
Okay.
in.
Any key strategies in terms of workforce?
Absolutely. So again, in many ways, it starts by redefining the work, because the workforce is not coming back the workforce that we were used to. So wherever we are looking at, wherever automation can help in reducing some of the mundane tasks, we're deploying it. We're also changing or exploring different care models where home-based care is now coming in, so that not only do we provide the care at the place closest to the customer, but also at an affordable price point and with the least disruption to the current provider shortages. So those are just some of the strategies that we're looking at in defining different care models.
Okay, great. What's some of your biggest challenges? And I know how many months you've been there.
2 months now.
Okay.
So I've been with the organization for 2 months. It's an amazing group of people. So we are in the business of eradicating cancer, as I mentioned, right? So we have labs. We have amazing research happening. We have world-class labs where we process the samples that come to us. The focus areas are, for me, are really integration. We have acquired a number of labs. So we are standardizing a technology platform throughout the university, which I think most people don't, know, but is a differentiator for our tests. The technology platform that Exact Sciences is developing, like Chiro said, our strength is people. There's a huge focus on talent retention, talent attraction, and just growing our pipelines. And the more tests we have, the sooner we can screen, the better we can help eradicate cancer. That's basically our mission.
Okay. Well, we all like to hear that you are trying to eradicate cancer, right?
Absolutely.
Absolutely. So anything at the conference so far that's of particular excitement or inspiration, why don't you go first, especially since you're coming now from, you're considered life sciences?
That's right.
Okay.
We are life sciences. Look, CHIME is a special place, and I get to meet my colleagues from the healthcare provider space. It's lots of fun. There are, of course, I would say the topmost theme is AI, which Exact Sciences is also very much, we believe, the future of cancer detection. AI is going to play a pretty significant role in many ways. So it's one of the themes that's clearly emerging at the conference is AI and the focus on AI.
I'm looking forward to the keynote
Yes,
on AI. I bet the room will be full.
absolutely.
If people haven't gone to the airport yet, yes, it'll be full.
Absolutely, yeah, it'll be full. So, and there are a number of other, on leadership, interoperability again. We spoke about innovation just in the previous panel. So far, excellent conference.
Good. Good.
So I
How
would
about
say
you?
same thing. I don't do a lot of conferences. CHIME is the one I try to do
I know you
for
don't.
all the reasons that Nassar mentioned. But this one in particular, I'll tell you, what I really have enjoyed so far is the discussion on the people aspect beyond the technology aspect. So Sue, you and I were on the DEI panel the other day. That was very important. Later today, we're talking about just talent. How do you groom talent and retain talent, which typically doesn't get talked about in a technology conference.
Yeah.
And so we are practicing what we tell others, but the people before the technology, which makes this one a little extra special.
We'll get back to our show in just a minute. Having a child with cancer is one of the most painful and difficult situations a family can face. In 2023, to celebrate 5 years of This Week Health, we have partnered with Alex's Lemonade Stand all year long with a goal of raising $50,000 from our community. We've already achieved that goal and we've exceeded that goal by $5,000. So we're up over $55,000 for the year. We want to blow through that number. We ask you to join us. Hit our website. In the top right-hand column, you're going to see a logo for the Lemonade Stand. Go ahead and click on that to give today. We believe in the generosity of our community and we thank you in advance. Now, back to our show.
That's great. I went to a track session that was a multi-generation workforce and just learning and working with Jen.
That was amazing. That was a really good session.
Yeah, you were there?
Yep, I was there.
Yeah, good. So anything in particular from 2023 from an innovation perspective that you've been doing at UW Health you want to talk about?
Yeah, so we were very proud to be the first in the country to use large language models in dealing with some of our in-basket fatigue issues that the whole industry is suffering from, thanks to the partnership with Microsoft and Epic. And I always say that is the start, that is not the end. So now that we've got that one behind us, we are leveraging AI in some meaningful ways, not just for the sake of using technology. Again, I've said this before, I think ambient listening from a technology standpoint is really ready for prime time. That also, hopefully in my lifetime, our lifetime, allows us to think of data entry beyond a keyboard and reduces the stress on our providers. So those are the two areas that I am really interested in as the technology, on the technology front, as we go into 2024.
Okay, and the large language models, that was what you were getting a lot of press on, right? I
Yep.
talked to you earlier this year and you're like, oh my God,
Yep.
Okay.
So
All right, but that's good.
it was much needed good press, because beyond the technology, at least the points I try to make out is where is the ethical governance, where is the moral governance, where is the legal clarifications, and the clinical, and the technology comes the last of the 5 pillars when we talk about it. That's where the conversations are to take place.
Yep.
So.
Great. Okay. So to ask the question about 2023, you've been there 2 months.
Yeah, so look, I've been there 2 months, so there's not much I can comment for Exact Sciences other than that it's an amazing, growing company. But future is really bright, and what I'm most excited about, so my healthcare provider background coming into life sciences company and knowing that our customers are really providers in healthcare systems. So, right, 50 million people in the United States who are not screened for colon cancers, right? So
We're not getting screening?
Yeah, they're not getting screened. So one of my goals is how do we increase that percentage point? And I believe that we can play a role there.
Yeah.
There are a couple of things that are from a technology perspective that I'm really excited about. One, almost 40% of our orders are still coming via faxes or forgeries. So Chiro and I already discussed.
Faxes are portal?
Yeah, that's right.
Okay.
So and we all know, like from living in a provider world, we know that the best thing we can do for our provider is to allow them to work within their operating system, which is whatever the EMR they're using, right? So electronic interfaces with the other healthcare system that will allow electronic ordering and resulting back to speed data, fast turnaround time, so on and so forth. That we all know the benefits. That's, I would say, top of mind for me. And the second thing, which is internal, is just bringing all our technologies, which came to Exact Sciences through these amazing acquisitions, on a single platform, so we can truly leverage all our assets, especially data assets, to further enhance our R&D processes, and also bring that single platforms to our partners by way of data insights, better prior authorization, faster turnaround times, and so forth.
Okay, so you started by telling us that Exact Sciences, ColoGuard, and we know that, we see the commercials. What are the others?
So precision oncology, absolutely. So we are, one of our product is the standard of care when it comes to breast cancer detection. It's called Oncota DX. And we have a number of other products and a pretty robust pipeline. MRD, MSED is some of the areas where we are doing significant research and really, I think, leading by the example.
Excellent. Now you're both in Madison. You both know each other already because you were at Jefferson Health, probably knew each other then, right?
Yep.
Is Exact Sciences working with UW Health yet?
Yes, already.
Yes.
Yeah. So
Okay.
I would say, since we are doing this on the video for This Week Health, Nassar and I actually did a 229 together too earlier
okay.
this year. So
All right.
Bill gets all the credit for bringing the two of us together in many ways.
Okay.
No, I think it was like in the first week Nassar was in Madison.
Yep.
He and I got together. We started talking about how do you take this from a tactical or a transactional partnership to a more strategic partnership, because the community in which we live are both our patients. So
Sure.
why wouldn't we do it for our own
Sure.
communities?
So, and maybe I'm getting ahead of myself. Is there potential for your integration and partnership to be in any way a model?
Absolutely, that's the goal. So we already have a basic integration, but we are going to be talking, and Chiro and I, of course, with our other leaders in the organization, take it to the next level from data sharing perspective, from especially our precision oncology line of business. And I know that our leadership, quality leaders, physician leaders are also talking to each other. So we just are trying to bring everyone together.
Good. Okay. This is great. Thank you so much. And I look forward to hearing more about this partnership and what you're both doing. So thanks for stopping by.
Thanks
Thank
for
you
having us
again.
over.
Another great interview. I want to thank everybody who spent time with us at the conference. I love hearing from people on the front lines. It is phenomenal that you shared your wisdom and experience with the community, and we greatly appreciate it. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. They are CDW, Rubrik, Sectra, and Trellix. Thanks for listening. That's all for now.